We have 1 minute left for this session.
No questions? Thank you. Oh, sir. Yes, sir, definitely.
Mike, please.
Sir, older patients with poor performance status who would probably do well with radiation. But if I have a young patient who's motivated, he's 60 years old, I give him radiotherapy, and let's say a point comes where he might need to have some salvage treatment, then doing salvage prostatectomy for me in that setting would be more difficult than for the radiation oncologist to give salvage radiotherapy after prostatectomy.
Limitations related to the primary and limitations related to the different, where you are not going to operate.
Sir, if it's a T4 tumor, if there are enlarged, if there are lymph nodes in the pelvis,
1 centimeter, 2 centimeter, multiple, single.
if you have multiple lymph nodes, if you have conglomerate pelvic lymph nodes, very bulky lymph nodes, then that patient would be better served by giving hormonal and chemohormonal therapy along with radiotherapy, rather than going ahead and doing an extended pelvic lymph node. However, that being said, it is also said in the guidelines that suppose you have gone in with the intent of doing a radical prostatectomy and you discover that the patient does have some lymph nodes like this, you should not abandon the procedure and you should in fact do a extended pelvic lymph node dissection. Although I don't know the feasibility of that. My career is very short till now. Yeah.
Thank you,
Okay.
Dr. Rahul. May I request the chairpersons to please come down and be seated, because we have a panel discussion and the panelists will be seated on the stage. The next panel discussion is on cancer survivorship, a view from the other side. As moderator, I would like to invite Dr. Sanjay Adla, who's a consultant uro-oncologist, surgical uro-oncologist from Apollo Cancer Institute, Jubilee Hills, Hyderabad. And as panelists, he'll invite the patients and patients' advocates. Over to you, sir. You have 30 minutes.
They haven't yet come onto the stage. All. Thank you very much for the, I haven't yet started, I'm waiting for my panel. Okay, thank you very much for this opportunity. We have been discussing about what treatment to give to patients.
Please
Now-
start the timer 30 minutes after the panelists are seated, then start. Thanks.
Rupali.
Actually, 25 minutes, sorry. It's 25. 1 minute. 30 minutes, sorry. 30.
You can walk a bit slowly, I'll get a bit more time. Okay, so the time is for us to understand what a patient goes through when they are given a decision or given a treatment plan, and how do they perceive things. So the objective of the next half an hour is going to be a view from the other side. And I'm very grateful for the people who are sitting here. I'm going to introduce from this side, going that way, Mr. Murthy, and I'm very, very grateful for yourself being here, sir. Okay, and I've spent quite a long time having discussed the scenario of teaching the doctors who have treated them. Okay, so I've got Mr. Murthy who had metastatic testicular cancer and had to have orchidectomy, following which he was given chemotherapy. After that, he has been fine for the last 3 years. That's one. The second is Mr. Raj Naya, who underwent radical prostatectomy and had to also undergo salvage radiotherapy. And more importantly, he had to also nurse his wife who had triple negative breast disease. And so he has got experience of going through it as well as nursing somebody. The third lady is Mrs. Fatima Baig, who underwent a left-sided nephroureterectomy, following which she is on care for non-muscle invasive bladder tumor. And then I've got Mrs. Rupali, who, Geetali, you keep changing your name. Geetali, yes. Geetali, she runs the Little More, which is a NGO based out of here. About 150 volunteers work in and around Tata Memorial Hospital providing this care, filling the gaps wherever they can. Okay? That's just for you being there. Thank you. So, and me, I'm Dr. Sanjay Edla. I've been delivering cancer care for about 18 years. And when I had to sit on the other side of the table, when my dad was diagnosed with lung malignancy, it was a totally different ballgame. Everything that was coming there were like bouncers. I could not face up to anything that was given to me as news. So we'll start off with Murthy, who is the youngest of the lot. The day you were told that you have got this testicular cancer, that's one, and this testicular cancer that has spread elsewhere in your body. Just speak and see if it works.
Hello.
Yeah, okay. So what was it? What went through your mind?
First of all, thank you so much for calling me here, sir. I would like to say most of the doctors were not interested to probably listen to the patients. Before half an hour, I could see a lot of doctors here, and most of the doctors went out. So I feel that most of the doctors should be here when patients, because this session was organized. So if I'm being little rude to the doctors, then it is a fact. So obviously my mind was very blank. I have been in corporate working for almost 25 years. When I got detected with the cancer, the first thing which came to my mind were 3-4 things. One, will I survive? Will I live? Or am I going to die? Number two, what is going to happen to my family if I die? Number three, are doctors going to be good who will treat me? Will they treat me well? Will they treat me, will I be fine after this? So these are the first 3 things which came to my mind. And fourth also, very importantly, even if I survive, what is going to happen post thing? Because it is going to take a lot of time and all that. So these are
now
the things.
Now that you're 3 years following your clearance,
yes, sir.
What one of those fears was relevant?
Now my those fears have gone now because I've survived. It is because of the doctors who have given me the very personal attention, treated me well. I'm live and kicking. But now I lost everything because of the 2.5-3 years which went through this entire cycle of treatment. So what is my future going to be? So this is the biggest thing. And not only this, because I have been very active in terms of participating in the patients' meetings, and most of the doctors in Tata knows. Dr. Amit Joshi, who's been, so even patients express this kind of feeling that what are we going to do after this? So that's a very, very...
Mr. Nai, you had the unfortunate situation of you being told that you have got a cancer, and then you had to hear much further bad news when you had to hear which one was more painful for you to take?
My getting cancer was not a problem at all, because I had a meeting with my doctor who was sitting here, and he explained exactly what is the situation. I said, I have no problem. And he told me that if you can afford to wait for a year and then decide on surgery, or if you wake up in the morning and say, I got cancer, then let's do it now.
No, sorry. The way
not a problem.
I was trying to look at was being told the diagnosis of cancer, irrespective of the stage, to you and to your loved one. Which one is more difficult to take?
The wife.
Okay.
Because there you can see some issues which you don't feel physically. In my case, there was no physical issue.
Mm-hmm. So just because there was a physical issue, that you found that a lot more painful.
Yeah, seeing my wife having a problem was a bigger problem.
Much bigger problem compared to you going through.
Mine was not a problem at all.
Okay. फातिमा जी, जब आपको बोला गया था कि आपकी लेफ्ट किडनी निकाल देंगे, आपको कैसे लगा था? वो कैंसर है, वो दूसरा चीज़ है. एक पार्ट आपके अंदर से एक निकाल दे रहे हैं उसके. आपकी क्या सोच थी तब?
Thank you, sir, and good evening, everyone. Sir, थोड़ा as we know कि cancer is deadliest disease. तो ऐसा तो नहीं है कि मुझे डर नहीं लगा और मैं पहले ही उठ के खड़ी हो गई कि हाँ नहीं मुझे स्ट्रॉन्ग रहना है और मुझे ऐसा रिएक्ट करना है. तो रिएक्शन तो जैसा सबका रहता है नॉर्मली, वैसा रिएक्शन मेरा भी था कि हाँ आई क्राइड और बहुत टेंस्ड हो गई, डिप्रेस्ड हो गई कि क्या होगी मेरी लाइफ इसके बाद. अगर मेरी किडनी निकल गई तो फ्यूचर में क्या अप्स एंड डाउन्स आएंगे. बट फिर फाइनली मैंने डिसाइड किया कि अगर मैंने अभी ये स्टेप नहीं लिया तो आफ्टर 5 years अगर मैंने थोड़ा भी वेट किया तो क्या कॉन्सिक्वेंसेज होंगे, तो मैंने डिसाइड किया है कि मैं इसको ऑपरेट कराऊंगी और बाकी फिर
Okay. I'm going to ask Geetali, what is the support structure like in India? Like when I was working in England, you understood certain. What is the support structure? How much of a contribution with respect to the care of the patient comes from friends, comes from the immediate family, comes from the society or the doctors? Who are these patients looking at, support structure wise?
So we really cannot compare the support structure that is abroad and
That's
in
why in
India.
India,
The
yes.
reason being we are still not a nuclear family. We are very much having joint families. We have our friends. There is even the neighbors. They are considered as relatives, part of the family. So there is a huge support system that comes in, but sometimes it becomes a dangerous support system also because of the misinformation and miscommunication of things that comes in.
And I'm going to do this one. I'm sure the people, my colleagues who were there working in UK. So the way it used to happen in UK was every new cancer patient would see my nurse specialist who would do this holistic assessment. So before I saw a patient, I knew what was their financial situation, whether they go to church regularly or not, how much of a dependence they have emotionally on the church, and who is the immediate family with respect to financial help as well as emotional support. So I could understand a bit about the patient, then I could understand about the disease. So this is what was a part of the holistic assessment. Sir, Raj Nair, sir, you had, unfortunately, you had to have treatment here in India as well as in UK. What came across as a stark difference in the cancer care?
My wife had to undergo treatment here as well as in the US at Anderson. There's a huge difference. The quality of doctors is about the same. The kind of pressure on doctors here is unbelievable compared to the doctors there. I got 90 minutes, my wife and I got 90 minutes in front of the doctor. Here you're lucky if you get 2 minutes or 3 minutes. And for that 2 or 3 minutes you have to wait for maybe 3 hours. That's a pain, real pain. So there's no, because, okay, I won't get into answers which are beyond your question.
Yes, sir. Okay, so if you had to go through your experience as well as your wife's, what was good and what would you like us to change going back to our work on Monday?
Okay, let me
And
say
that is within the realms of changing ourselves, not
yeah,
the system.
Yeah. I don't want to be critical about doctors here because they're doing a fantastic job. And among the various subsets of in the medical profession, and I'm not saying this because I got oncologists in front of me, oncologists are a breed apart. Because we find them care. They're also knowledge seekers because the field is, there's so little known and so much being developed. So I'm very comfortable when there are doctors who are trying to seek knowledge all the while. Therefore, you'll get good treatment. That should continue. However, the systems are obsolete. I want to use that word obsolete because a doctor is not trained for admin, but they're made to do admin. The more senior they get, the more admin they do instead of giving more patient time. It's ridiculous.
Okay.
I'm using a very strong term,
Yeah.
but it's ridiculous. Second, and that doesn't happen elsewhere. Second, if you go into a doctor's room in many hospitals, I'm not talking TMH alone, there'll be 2 or 3 doctors inside. 2 younger doctors. Young doesn't mean inexperienced. 8, 10 years, solid doctors. But they're sitting in the same room and one patient's there. When we have a shortage of doctors, why can't we leverage doctors better? I mean, in all other professions we do it. Why not in the medical profession? And there are ways. I don't want to get into details. I'm happy to spend time on this after this. The third thing is, why do we forget that there is something called paramedic who can do a lot of work which the doctor does and spends time unnecessarily on?
So you would like to improve the overall access between a healthcare provider and the patient?
Yes, by changing the mindset of the institutions who are thinking that they are they're patient-centric, but they're actually optimizing on infrastructure and number of senior doctors, which is a mistake.
Okay, Murthy sir. So if you were following your treatment, I know majority of it went fine. I just want to know what you think should have been improved. With your care, not aftercare, care.
No, fortunately, I have been very lucky. I've got the best of the attention with my doctors. I've got the best of the, personal connect which happened. That is what, when you asked me before 2-3 days ago, that personal contact, connect with the doctor gave me a lot of strength to fight back. So which I feel most of the hospitals, especially TMH, it is not possible here in TMH because of the density of the patients. But if it can happen, as he said, if we can improve the, removing those administrative works from the doctors, and if we can spend 5 more minutes understanding and connecting with the patient, that will have a lot of impact on the patient's mind, because it plays a larger role than the treatment, because we all anyway go through the pain. That we have decided.
Okay.
We have accepted that we have cancer. We have cancer and we have to go through this painful period of next 2-3 years, whatever. But that personal connect is very, very important, I feel, in my personal opinion. Fortunately, I've got it. But is every patient getting it is a question mark.
ओके, थैंक यू। फातिमा जी, जब आपको ये बोला गया था कि आपके किडनी में कैंसर है, यस, आपको कभी ऐसा लगा कि अरे यार, भगवान या अल्लाह ने ऐसा आपसे क्यों किया है? Did it ever make you question your faith?
सर मैंने उसको पॉजिटिव वे में लिया कि मे बी इट हैपन्स बिकॉज गॉड हैज़ सम प्लान फॉर मी, ही वांट टू टीच मी समथिंग, तो इट्स all upon a,
Okay, I'll ask, what did he teach you by giving you cancer?
sir, some more kindness.
Yes. एंड आपको अभी ट्रीटमेंट हो गया, अभी आपको लगता है कि आपको अल्लाह पे ज़्यादा फेथ है या कम फेथ है?
सर और ज़्यादा।
क्यों ज़्यादा हुआ? उतना ही रहना चाहिए था।
नहीं सर, बिकॉज अगर मैं एक बात बोलूँ कि द अल्टीमेट सोर्स ऑफ पॉजिटिविटी एंड एनर्जी वो स्पिरिचुअलिटी है, और उसी से मुझे स्ट्रेंथ मिली है। और जो ट्रीटमेंट के दौरान जो उस ड्यूरेशन में जो मेरी हीलिंग प्रोसेस हुई है, वो इसी की वजह से थोड़ा मेरी फास्ट रिकवरी हुई है, मेरा ऐसा मानना है।
Okay, I mean this one is a stark difference. Though we are supposed to be learning from Western. When I was in England, we used to have a on-call priest and on-call the local